So today we're going to be talking about blood pressure. It's a massive topic and most people are very, very nervous when they come in for the medical. Hey guys, it's Dr. Walji again from Simply Medicals. So today we're going to be talking about blood pressure. It's a massive topic and most people are very, very nervous when they come in for the medical. So one of the main things is the DVLA are very lenient with regards to the blood pressure and when you have to stop driving because of your blood pressure. So their main concern is it consistently higher than 180 for the systolic, which is the top blood pressure reading, and higher than 100, which is the bottom reading, okay? Now, there's a few things that we need to address with this. So first of all, white coat syndrome. A lot of our medicals, people come and say, I've got white coat syndrome, and their blood pressure is high. Some of them, it's above 180 or the bottom one is above 100. I normally try and give as much time as possible just to really help calm the person down so that you can actually do your medical and pass it. Many times this doesn't happen and it doesn't drop down enough for us to actually give it to the pass level. So what does that mean, doctor? I can't drive anymore. No, that's not the case. So normally what happens is there's two levels of high blood pressure. So there's one where it's high, but it's okay for the medical, or it's too high for the medical. So I'm going to address the one where it's high, but okay for the medical. When that happens, check your blood pressure twice a day for a week, write down the lowest readings, and then take an average over the week. If it's above 140, your average for the top, or the bottom one, the average is above 90, then you need to speak to your GP. That's fine. Those people pass, they get through, no problem. Now, the other group of people that have high blood pressure, it goes above 180 and above 100. When it's at that level, that is a dangerously high level. That's a level where I would normally advise people to get urgent medical advice on the day rather than waiting to see your GP during the week. The problem is that when it's that high, in most cases, you actually have an underlying high blood pressure even when you're at home. When it gets to that level, it's better to get it checked. The problem arises when your blood pressure is uncontrolled. When it's at that level, it is uncontrolled. However, if you get urgent medical advice, you can try and get your blood pressure down with some medication. Then you come back for your medical and then we can pass you because your blood pressure is going to be well controlled at that point. The whole point of the medical is not to pass or fail you. The whole point of the medical is how can we make you safe for driving? And that's why we offer this thing called a free retest. So you come in, let's say your blood pressure is way too high. No problem, don't worry. Go to your GP, get urgent medical advice depending on how high it is. Come back once you've got your medication. It's within the normal limits. Boom, you're through your medical. That's why we always advise that don't leave your medical for the last minute, please. Because if you get worked up, you might fail your medical just because you're worked up. And we don't want that. One thing to note for people that are on blood pressure tablets, if you do have a blood pressure machine at home, it is a very good idea to get your last 3 blood pressure readings before you come in. And if you have them written down, you can just bring them in to our surgery so that we can write them down on your form. I hope this helps. If there's any questions that you have, feel free to give me a shout.